Shada Talabreza, and I'm a geriatric and palliative medicine doctor with the VA healthcare system. Do you have a serious illness, or are you at risk of developing one? If so, it's important to think about what matters most to you. Different people want different things, and what matters to you should guide decisions about your treatment plan. That includes any decisions about mechanical ventilation. If you have a serious illness and have trouble breathing, this may lead to a condition called respiratory failure, where your lungs can't keep up with the hard work your body is doing. If you have this condition, you have choices about treatment options. One choice might be mechanical ventilation. Before making a decision about mechanical ventilation, it can help to know what mechanical ventilation is, possible benefits and risks, and how these risks could affect your life. This video will give you some information about mechanical ventilation, but it doesn't replace a conversation with your healthcare team about whether or not mechanical ventilation would actually help you. So don't make a decision based on this video alone. Talk to your healthcare team about your medical condition and what's most important to you before making decisions about mechanical ventilation or any other life-sustaining treatment. There are two basic types of mechanical ventilation: non-invasive and invasive. With non-invasive mechanical ventilation, a machine pushes air through a mask that you wear over your nose and mouth. In certain patients who can't breathe well on their own, non-invasive mechanical ventilation can be used to help them breathe while medication is given to help them recover from their illness. With non-invasive mechanical ventilation, the machine provides air pressure with every breath the person takes. Non-invasive mechanical ventilation can have possible side effects. It can be hard to talk clearly, and eating isn't possible while the mask is on. For these and other reasons, it usually isn't possible for someone to receive this treatment continuously. If breathing isn't better, or if it gets worse, the person would need invasive mechanical ventilation to provide more breathing support. We'll talk more about that in a minute. Some people choose not to use non-invasive mechanical ventilation when their lungs aren't working well. Whether you choose it or not, you'll receive care to keep you as comfortable as possible. You'll be offered medications to help you relax so you don't struggle to breathe. Sometimes a person's breathing problems are more severe. Some people may not be able to breathe on their own if they have very serious lung problems, severe weakness of the chest muscles, or damage to the brain or the upper part of the spinal cord. When that happens, non-invasive mechanical ventilation can't provide enough support. So one treatment that might be considered is called invasive mechanical ventilation. With invasive mechanical ventilation, a machine called a ventilator is used to push oxygen through a tube into your lungs. This tube goes through your mouth or nose and into your windpipe. The machine breathes for you when you can't breathe on your own. If you need the ventilator for more than about 2 weeks, you may need a short surgery to place a hole in your neck for the breathing tube. This is called a tracheostomy. In some patients, this type of procedure can help the medical team gradually get them off the ventilator. Depending on your type of illness, that may take days, weeks, or even months. For other patients, the tracheostomy would help them stay on the ventilator long term if their body isn't strong enough to breathe without help from the machine. If you're on a ventilator, you'll need a lot of assistance. You'll probably have to be in an intensive care unit or a similar setting. Some people who are on a ventilator for a long time can be cared for in a nursing home or even in their own home, but only if they have the right level of professional care. If you're not on a ventilator and your lungs fail completely, or if you're on a ventilator and decide to stop, you will likely die within hours to days. Sometimes a person unexpectedly survives longer than that. Whether you choose a ventilator or not, you'll receive medical care to keep you as comfortable as possible. There are possible benefits to a ventilator. It can make it easier for you to breathe or help you breathe while you recover from a serious illness. It might prolong your life, depending on your condition. Some people live for years using mechanical ventilation. At first, it might be hard to predict how long you would need it. Also, being on a ventilator has possible risks. It can be uncomfortable, and it raises your risk of infection. Generally, you would not be able to talk, eat, or drink, so nutrition would have to be provided through a feeding tube. If you're confused, you might try to pull the tube out. To prevent this from happening, you might be given medication to make you sleepy, or your hands might be restrained. Mechanical ventilation doesn't cure the problems that cause you to have trouble breathing. It just helps you breathe, or breathes for you, while your medical team works to treat those problems. Some people on ventilators never recover to the point where they can breathe on their own again. Some people do. It depends on the condition that's causing the breathing problems and their other medical problems. Some people with breathing problems would accept living with a ventilator for the long term. Others would want to try a ventilator for just a short time to see if they could get better, but wouldn't want to stay on it for a long time. Some people wouldn't want to be on a ventilator at all. Talk with your healthcare team about what matters most to you. Every person is different, and the best plan for one person might not be the best plan for someone else. Whether mechanical ventilation is the right choice for you will depend on your health condition and your goals and preferences. Your healthcare team can tell you if you're at risk for serious breathing problems and can make a recommendation about mechanical ventilation and other treatments based on your health condition and what matters most to you.